Megan Clare Show. I'm a breast cancer survivor, patient advocate, and your host, Megan Clare Chase. I am working with Ancora AI to help share their mission, which is to give unbiased and comprehensive information for patients to empower and bring vetted clinical trial options to all patients. Now, I am excited to have you meet the newest addition to Ancora AI's team. Welcome, Khamai Simpson.
Hello. Hi, Megs.
It's so good to see you.
It's good to see you too. I'm excited for this interview.
Well, tell us a little bit about where you're from and where you're located right now.
So I'm from Miami, Florida. I was born and raised there. I lived there until I was 18. Then I studied at the University of Rochester for undergrad. I studied public health and German. I ended up studying abroad, and I studied abroad in Germany in order to continue studying German. And I fell in love with the city of Berlin. Now I live here, and that's where I'm living, in Berlin.
Wow. I mean, it's not often that you hear that someone actually wants to take German and then becomes totally fluent in German. So that is a really hard language to learn. So bravo.
Thank you. I actually started learning German in elementary school. I went to an international baccalaureate school. So I learned German from the ages of 1 to 12, from the grades 1 to 12. And I wanted to continue with German in college.
My goodness, I think I should have gone to school in Miami. So tell me about the master's program that you're part of and what your thesis is about.
So I study at Charité's Berlin School of Public Health. And that's correct. I'm writing my master's thesis right now. The topic of my thesis is racial discrimination in the healthcare system in Berlin. And I'm doing a qualitative research project where I'm doing focus group interviews with people who have been affected by racial discrimination. And I will allow them to be the experiential experts. So they tell me about their experiences, what the experience meant to them. And when I analyze what they've said to me, then that will be the main data source. So I'm really allowing the statements and experiences of victims to be an actual data source. Hopefully, my master's thesis will be published, and this can really help to inform policymaking, decision-making in education for doctor, healthcare practitioners, as well as intercultural health management.
And talk about, so timely, but I think it's always timely to talk about the racial disparities and discrimination that people of color, have to deal with, which is really unfortunate. So fantastic that you're shining a spotlight on such an important issue for your thesis. Now, tell me, Khamai, what was your motivation for joining Ancora AI? How did you even hear about them?
I actually heard about Ancora AI from a friend who works in the tech field. She saw a presentation by Ancora AI, and she met one of the founders. And so after she met the founder, she told me that I should email her and talk to her about the work that I do in terms of healthcare access and disparities. And she basically told me that this sounded like a company that I would want to work for if I really want to make a difference in terms of giving access to disenfranchised populations. And also she said, it sounds like they really do want to make a difference. So I emailed with the founder, and I've been talking to them ever since. I actually wrote a blog post for Ancora first, and once I knew that there was a student position available, I knew that this was my chance to get on board with the Ancora team and see what kind of difference we could make.
And, just to let our subscribers know that when Khamai was working on her blog post, I was one of the patients that she talked to, and then that was how I knew her. So I'm just so thrilled that you're now part of the Ancora, team and family. So very happy.
Thank you.
Now, tell me this, what will it mean to you on a professional and personal level to work closely with, advocates and patient organizations to improve clinical trials?
At this point in my career, I would really consider that I have a lot to learn. And learning directly from patients is a perspective that I greatly value because patients really are, and patients should be, the main concern when it comes to people who have cancer and the clinical trials that they are choosing to participate in. I find that engaging with patients is giving me the perspective of what it looks like, what it feels like,
Mm.
and what needs there really are in the community. I definitely have a lot of empathy for
Mhm.
the cancer community. And I feel that at this point, I just have so much to learn. And I'm excited to be working with the Ancora AI team, with you especially, Megan. And I hope that it's just possible to move further in my career, always knowing that the patient perspective is the most important when it comes to healthcare.
That's why I enjoy working with Ancora AI, because they really are about making sure that patient voices are amplified and making sure that they understand that, clinical trials can be an option either in combination with current treatment or instead of a as another treatment in case the other one didn't work. Because I think so many people, think that clinical trials are only if you're stage 4, but that is so untrue. And that is what I continue to learn as I, do my little talk show here.
That's wonderful. Being a public health major in my master's right now, but also at the bachelor's level, we learned a lot about clinical trials and how they run. We are eligible for jobs where we would coordinate work in clinical trial coordination. However, working directly with patients is something that I really feel that would make me want to wake up every morning, to actually work directly with people. And this is something we don't necessarily just learn in college, is how to really connect and network with people that you actually want to serve and that you actually want to feel comfortable in the cancer care clinical setting.
Well said, Kame. Well said. So, as we wrap up, just tell us, what is one fun fact that you would like our subscribers to know?
A fun fact about me would be that during Corona lockdown times in Berlin right now, we have a hard lockdown. So everything is
Mm.
closed. We can't go anywhere. Um, we can take a walk or take a jog and meet one on one with people, but
Mhm.
all stores, all restaurants, everything is closed. And I started taking up yoga. So I actually do yoga daily. I started a daily yoga practice to teach myself discipline, but also just to move while I'm indoors. It's winter, and I like just release all of those hormones to make me feel good and to just exercise any way that I can, just in the comfort of my own home.
Can you stand on your head yet?
No, not yet. I'm working up to it and I'm just taking it slow, just patience, growing, and trusting the process.
Love it. Well, thank you so much for joining me, Kame. And again, welcome to the team and the world of clinical trials. And we look forward to, seeing how this helps you in your journey to your career.
Thank you so much.
So everyone, our next video will be about prostate cancer and breaking down what that means to have it and the side effects. So stay tuned. Be sure to check out the resources on Ancora AI by going to ancora.ai, where they humanize clinical trials. I am Megan Claire Chase, and remember, the more you know, the more empowered you will be.